Right, we're going to open it up now to any of our speakers so far in terms of questions. There's a couple of microphones roaming the floor. If you've got a question, stick your hand up. Can you identify yourself and then ask your question through the chair? Gentleman at the front there. Thank you.
Thank you. Mark Gillick, Royal Commission on the Ancient and Historical Monuments of Scotland. Big data requires big storage. What is the roadmap for helping the public sector, via shared services, I presume, store this data both for the immediate use and for the long-term preservation?
Possibly to John, was that?
Yeah. It's part of, as an element of the digital strategy the government's taking forward, the storage facilities and resources are fundamental. I think what we've, if I was to highlight one area where the approach in this respect has been compartmentalised, I think the storage of data is an example of where that has been compartmentalised in the public sector. And I think there is a much greater opportunity for us to establish, with the necessary firewalls and protections within that, the retention of that data and that information, a more collaborative approach to shared data centres that would exist. Now that's essentially a working priority of the government's board that's looking at digital questions, to essentially manage the collaboration amongst public sector partners as to how we can bring people together and to share resources and to share services. So the steps to date have been far too compartmentalised for my liking, and that's why the board is now looking at how we can take forward a more shared approach to the, with the necessary protections for the operation of that type of facility.
Malcolm, do you want to come in on this too?
Yes, I think that storage is only part of the challenge, and it's critical, but how we use it and what we use it for is a very interesting and long-term question. We used to have archivists who decided which papers we kept in our companies and our governments and our organizations. And today we need digital curators. And we're fortunate to have the Digital Curation Centre here in Edinburgh as the national centre developing the skills in thinking about how to preserve data in a way which it remains usable over decades, and in thinking about this really complex challenge of how to rationally choose which we keep and which we don't, because we can never afford to keep all the data that we have.
Sanjay, is there not an issue here where organisations instinctively want to hang on to information? They see it as being their information or potentially a marketable commodity.
Yeah, I'd say that even before I go into the commercial use of this data, we live in an interesting time where maybe for the first time in human history, somebody who's born today over the course of their life will leave behind a digital trail that in theory can never be erased or forgotten. That is, your entire life from birth through your hopefully 100+ years will be tracked and stored, maybe with your consent, but very likely without your consent. And so that data will be there. There will be a rich tapestry of information that will exist about you, and it will be accessed with and without your knowledge. I think that there is a great debate being played out in the private sector about how much data is worth. That there are marketplaces for data. There are many different ways that data are being used. I think that citizens, I've been surprised at how rapidly they've been willing to share information, deep, dark secrets about themselves, about their family, about their pets, about anything and everything in their life, just to get some benefit. And the benefit might be a sense of community, it might be enhanced friendship, it might be enhanced connectivity with people that they care about. but they're willing to put a tremendous amount of information into the somewhat public or true public domain in order to get some non-monetary benefit, but even some emotional benefit or some psychic benefit. So with that, I think that it's only natural as more data become available that companies are going to be looking for ways to mine it and profit from it. I think there's a large role in government to step in and be maybe a standard maker, maybe even a legal authority as to how data should be used. But I do think that in general, the genie's out of the bottle. That is, we're going to live a digital life. Our life will be cataloged and stored in a way that is going to be complete. We're in an era where people will never forget anything that ever happened to you, because it will be cataloged. And I think that in general, I'm optimistic in the sense that it will be used for good, but I do think there's an appropriate role for government to play in some degree of regulation, adding some degree of regulation.
I'm tempted to say, having been married for 30 years, I've already got someone who's never forgotten any mistake I've ever made. But Chris, is anywhere in this conversation, has anyone actually said, look, there should be some sort of opt-out clause here? I don't want to play this game.
There have been conversations going on about this, and can you opt out of this this whole agenda? My take on that is that, frankly, the world we live in, that's probably unrealistic. I think that the important question is, how do we get to a place where we can have a conversation with citizens about the data that's being collected from them and the purpose that it's being used for, right? So, in a medical context, for example, the conversation with your physician about the data that they are collecting on your lifestyle and behaviors and conditions and so on. A conversation which runs, we'd like to suck in all of that data because it's kind of interesting for us to have it all in one place, is quite a different conversation to one about, I'd like to collect your data in order to do some controlled data sharing to help us make some medical breakthroughs in the search for a cure for cancer, or whatever but that's difficult, and giving people the confidence that actually they've got access, the state has access to your data, but you've got the option to revoke that access, or you'd like to know that when it's been passed from one party to another, that you've still got some control over that. Really, really hard. And we've got to have a grown-up conversation about it.
Okay. Yep, by all means, Mark, you come in.
Sorry, just to chip in, going back to the notion of revolution, at the beginning of the Industrial Revolution, boilers kept exploding and people were killed by scalding steam. And we introduced the notion of chartered engineers, people who were professional about their behavior in designing machinery for public safety. I think we're going to have the same notion of chartered engineers who are taking responsibility and put in charge of the projects that manage and exploit data on behalf of people. You can probably do more damage to people with a digital system than you can with a boiler.
Okay. Any other questions? Gentleman at the front there.
Hi, Jens Rasmussen from Marine Scotland. So we kind of discussed data ownership at the personal level here, but there's another aspect of ownership, which are the people who generate and collate these data sets that feed into the big data stream. In some ways, we need to encourage ownership because we want them to do excellent documentation and metadata. But at the same time, we're sort of removing part of the benefit by moving the aggregated analysis upstream. How do we strike a balance between encouraging ownership of the people who collate and look after data, and at the same time get into that wider aggregation of data sets?
Again, it's this question of balance. Who actually draws the line? John, do you want to come in on that?
I think to link it with the last discussion, we have a situation in Scotland where every citizen has a unique health reference number. It's one of the great strengths in our health service and in the management of that aspect of people's information. Now, that's been arrived at. I generally don't think people object to that or have concerns about that. The fact that exists enables us at an anonymised level to be able to use information which assists with clinical research and development within Scotland. And generally, I think that is a very, at an anonymised level, a very well supported aspect of the strength of the Scottish Health Service and the clinical research community within our academic environment. I think when you then get onto some of the territory which is about trying to use that information or information that we hold to personalise the direction of public services to individuals, I think we do get into very different territory and very difficult territory. And I think it's, you know, I do take Sanju's point, it is incumbent on government to make sure that that is regulated and handled very, very carefully and properly, and that it's done to the satisfaction of members of the public. And that's why I use the example of the unique health referencer. I think we've got to a position where people are broadly comfortable with that approach. So I think it demonstrates we can get people to a point of contentment on these questions. I think the more that we, you know, without in any way casting any doubts on the approaches taken by some of the online retailers or whatever it happens to be, you know, I can remember the first time I used, you know, the Amazon website, and it recommended something else that I should read. I can remember feeling a bit kind of spooked by that. It's all gone with the mists of time. But I do think it's illustrative of the anxiety that members of the public can have if data about them individually is not handled in with the greatest of care.
You actually quoted the example of the little old dear who's staying at home and she falls and the ambulance has to rush her into the hospital and things like that, and wouldn't it have been better to put handrails in beforehand? You can use the data for that. But what price privacy? I mean, it's only a short step between a red panic button for a little old lady and having a webcam in there to check that she hasn't fallen over.
Well, I suppose you probably make progress on this journey, Mark, by having examples like that. You know, what is acceptable? You know, constituents of mine who live on their own take the most tremendous reassurance from having that red button in the house. It's just a tremendous reassurance for them. But you know, if I was to say to them, right, it's a webcam next, Mrs. MacDonald, I think I know what the answer would be, knowing some of the Mrs. MacDonalds that I represent. Anyway. So I think you probably, you know, there's a range of ways you can take that forward, and I think the key issue, if you take one of the other, we've also got to think about some of the way in which we design public services to try to see off some of these problems. You know, the Fire and Rescue Service in Scotland is the greatest example of a preventative service, because they now spend more of their time installing smoke alarms than putting out fires. It's a tremendous success, what they've done. Great unsung heroes of our country, but they actually are out with screws and drills more often than they are with fire engines, installing fire engines, installing smoke alarms to protect members of the public. That is often done by targeted activity on households they think have the greatest vulnerability. And I don't think people would object to that kind of proactive steps in managing the public finances. The more smoke alarms they fit and the less fire engines have to go out to very expensive incidents with enormous personal damage and injury, the better, in my book.
Picking up on this, Sanju, too, I mean, I confess the American health system is a complete mystery to me. I've never got my head around it. But you were talking about case severity, physicians actually looking at, you know, how people are sick, how the intensity with which they are actually sick. Now, you looked at how it impacted on hospitals, you looked at how it impacted on how they worked in relation to other doctors, but there was no mention of how it impacted on the patient. Now, is the driver to improve overall care or to keep costs down?
Yeah, now I think there's, generally in these analytic systems, there's an operational efficiency drive, which gets to issue of cost. There's a productivity drive, which is to get to issues of quality. And I think that those are often both drivers in many of the systems that I've seen. I think that in this case, the initial push is to figure out where the money is. So, you know, as they say in crime, follow the money. It's also true in data, which is follow the money. And in the case of the healthcare system, the money is actually in the system and less with the patients right now. That is, there's a lot of waste, and there's a lot of misuse of funds that are in the system. And so there's a lot of opportunity to fritter out the inefficiencies and to improve quality by going to the providers, in this case the doctors, and making sure that they're more efficient. That said, we're moving very rapidly in the U.S. and I imagine worldwide to the digital monitoring of vitals. That is, you know, in the U.S. and I haven't been in Europe long enough to know, but a lot of folks down in the U.S. are wearing bracelets that monitor all kind of vitals. They're being published to their phones, which are then being published to hard drives and then being uploaded. And this is what people do so they can self-monitor. They can be more self-aware of their health. And so I do think that the first push is going to be in the health system because there's a lot of money there. But I think the next step is people taking more responsibility and being more aware of the way that they're living their life, benchmarking their lives to other people's lives, and saying, I think this is what I could do to improve my own weight loss or my own diet or my own cardiac condition, and just by increased awareness. So step one, go after the money, which is right now in the system. There's a lot of reward for wreaking out, you know, or wringing out inefficiency in the system. Second step, though, is get to the individuals who can, in fact, improve their own lives just by monitoring their own data.
Chris, this sounds like my idea of living hell. I'm asking for, you know, it's just, you're going to have technology nagging you in the future.
So the thing that I take away from this is there is tremendous opportunity, if done right, to personalize services and products for citizens in a way that meets their needs and eliminates all of the interventions which at the moment happen and actually have not been asked for and are not relevant. But as you know, you were asking the question earlier about you know, should there be an opt-in or an opt-out for this sort of system? And I think that's one of the areas where it's incumbent upon government to give people that option, right? So it's not saying, actually, I'm going to force you to take a particular product or I'm going to force you to sort of withstand a particular intervention, but recognize that in the consumer space, if I don't like Amazon pushing recommendations at me, then I don't shop at Amazon. But I don't have a choice with a lot of public services. So it has to be run in a way which is much more aware of that need for the citizen to have that degree of choice.
There's people who liked this medical treatment also liked. Any other questions? Lady at the front there.
Thank you. Edith MacArthur from Renfrewshire Council. We do observe, you know, from a public sector perspective, the Scottish Government do quite a lot of initiative, like, you know, the recent program on the SWARM program, which is the Scottish Wider Network, Area Network, is allowing, you know, data sharing, which is very good, you know, is actually in progress. It's good, you know, to see that. But from our day-to-day, you know, operation experience, as what, you know, John Swinney, you know, you mentioned about, you know, the National Health Service using the KAI number, which is a unique identifier, to make sure that we can reuse that identifier to help us to identify persons, individual leads, and we can, you know, jointly provide a good, you know, public service. But there are some issues and difficulties for public sector, and we need some support from the central government as well regarding, you know, data quality. Professor mentioned about, you know, how we actually surface the data, identify, and, you know, we use the data. Data quality is one, you know, big issue for us to tackle, and that required, as what, you know, Chris mentioned about the data scientist, and, you know, the capability and responsibility, and that is a huge challenge for public sector. I don't know, you know, how the government can help, because we know that, you know, budget cutting and local government, we have a huge challenge to actually open up a new post to get, you know, more data analysts coming in, data engineer to help us. So how are we going to tackle, you know, all this problem? At the time, you know, we, from the Digital Future, you know, strategy document mentioned about a lot of infrastructure development. But on the other hand, on the business side of it, how to deal with, you know, the skills and meeting people's lists. I think there's still a big gap we need to face.
John.
Well, clearly in the financial context in which we're operating, we have got the challenges that you highlight. I entirely recognise, and in terms of the funding decisions the government has made, we've tried to take those decisions in a fashion to provide the maximum stability to different elements of the public services, and of course within local government has had essentially a more beneficial financial settlement than most other parts of the public sector have had. That has been to assist local government in trying to make some of the transition that is required. I do make the point that as part of the reform of public services, there is an inherent pursuit of more efficiency. We have to make the money go further than it currently goes. And within the type of changes that individual public bodies have got to make, the creation of space to enable public bodies to properly handle data with the right levels of expertise must be part of the forward planning and the consideration of individual public bodies. So, if we look back 20 years, the need for analysts of big data was next to non-existent 20 years ago, but we have a relevance and a need for it today. So public services must constantly change and adapt and evolve to the demands of our time. We're having to do it in particularly straitened financial times, I accept, but the challenge that everybody in the public sector faces is about how we can make the resources achieve more as a consequence of the decisions that we take. And I think much of what we've talked about today actually helps us to make the money go further. You won't be surprised to hear that I generally don't subscribe as the Finance Minister to the view that you have to spend more money to deliver a better outcome. I suspect my colleagues are fed up hearing that from me, but I think it's an important principle that we actually stretch and test the resources that we have at our disposal to maximise their effectiveness.
I'd quite like just to go down the panel and get a comment for all of you on this. If you could be concise, gentlemen. Chris,
Yeah,
please.
of course. So, and you mentioned data quality. So, three things that strike me. One is, and Sanji's probably a better place to talk at this, some of the technologies that exist now let us handle messy, unstructured data and so on in ways which were very burdensome before, but actually now are relatively light. The second thing is about, you've got to look hard at the incentives in the system, right, for the people who are dealing with the data to understand that it's not good enough to just get the data entered and move on, but actually that it has a wider benefit, so you've got to invest the time in that. And initiatives that are happening, like in the health service, for example, to teach doctors and nurses to code if they want to do that sort of thing, so that they understand a bit more what can be done with the data and can develop insights, I think are really important. And the third thing on data quality, and this doesn't always go down so well, but provided it's not deeply personal data, part of the answer is you open it up. And it will be really uncomfortable if your data's a mess, but you get it exposed and out there, and people will find the errors and they will help you fix them.
Sanju.
Yeah, there's a broader question here of what's the role of the government, public sector in this generational march towards the openness and sharing in data. And I had this debate with the CIO of the United States, Vivek Kundra, who launched the Open Data Initiative in the Obama administration and is credited for sort of this open source data movement. And I said, clearly that's a great first step. So you lay down physical infrastructure, which might be broadband. You have a set of data infrastructure, which might be open data. But ultimately, we need to move to a set of data standards and data interoperability. And that's a great place for government to have a leveraged investment. And I liken it to, in the Industrial Revolution, when railroads came along, to move across the United States was difficult because the railroads were in fact different gauges. You'd have one size railroad in the east, another size railroad in the west. And until the government stepped in and said, we really want this to be the standard railroad gauging across the country, you couldn't move all the way across the country. What I see is a good and leveraged role for the public sector and for government is to lay down the same gauge data infrastructure in each one of the private sector areas where in fact data could be leveraged. An example might be in the real estate sector where office leases are right now about 6% of the cost of running a business. And so to the extent that you go in and you have office leases which are standardized, and you could put the 400 elements of a lease into a system and say, here's what it really costs to operate in Edinburgh versus the suburbs of Edinburgh, it'd be very useful. So this idea of having a set of standards or protocols by which data is shared and stored and communicated, I think would be a very important place for government to play a role.
Thank you for that. And finally, Malcolm.
Yes, I would back up this need for standards, but the standards never cover everything, and there are always many ways of interpreting the standard. So the dynamic adaptation is really important, and I think the agile construction of user interfaces, the dashboards that Sanju described, is a key element for enabling people to understand data and improve quality. But most fundamentally, and taking a reasonably long-term view, it's education. We really need to invest in education to enable us to have data literate managers on the scale we want, to have enough data analysts in the context. I see it as important that the domain experts get educated in order to talk to the people who do data analytics. I agree that they will do things themselves, but they also need to be in these conversations. And the conversations need the language, and the language is built through education. Scotland is very good at education, and it's small enough to transform its education system very quickly. So it'd be wonderful if it would do that. There are also a great number of new things coming out of research in Scotland, as the Minister said, and it would be very good to translate some of those things for handling cleaning data, for handling missing information and so on, without introducing errors. But it's a big job, and education should be preparing people for it.
Thank you very much, Malcolm. Right. Slightly over time, my apologies, but if you could just thank our four speakers in the traditional style. Thank you.